I'm Betty from Pension Insurance in the Personnel section, and I want to talk to you about benefits that are available to you as a state police employee. As a new employee, I want to let you know that we have a health program. It also has a vision and dental benefit. We're going to talk a little bit about that. We're going to be talking about life insurance today, your retirement fund, and some other benefits that are available to you as a new employee. The first thing I'd like to show you about is the health insurance program. Indiana State Police are self-insured since July 1 of '89, and so we have Indiana State Police health insurance. I'd like to show you a little bit about the booklet, and then I'd like you to review the booklet in your packet after you have had time to do that. If you'll give me a call, we'll discuss this if you have any questions. The first thing I'd like to show you about is the fact that if you are hospitalized, they're going to pay 100% of a semi-private room. They would pay that for 365 days. God forbid you had to be there that long. If you are in a private room, because your doctor says it's medically necessary, they will pay for it. But if you choose to have a private room just for your convenience, they're going to pay what a semi-private room in that hospital would have been, plus $4 a day. So if you're not there for an emergency situation and you have time to plan for that, you may want to see if you want to have the private room, knowing that you'll pay a small portion of it. There's no deductible on a hospital room. We also have excellent coverage for surgery. Surgery would be paid at 100%, no matter if the surgery is in the doctor's office, in the hospital, in a clinic. No matter where the surgery is performed, it will be paid at 100% of a reasonable charge. There is no deductible on surgery. Your outpatient diagnostic services, things like x-rays, lab tests, those things will be paid at 100% of a reasonable charge, and there's no deductible on that either. The only thing you do have a deductible on is major medical expenses. Major medical expenses are things like office calls to your doctor and prescriptions that he would prescribe for you. And you have a $50 deductible per person. So if you have a family, it's going to be $50 per person, but there is a maximum of $150 per family. So it would be $50 per person, up to the maximum. Emergency illnesses are covered at 100%, and because they are emergencies, there's no deductible. Emergency accidents are covered at 100% as long as you go within 72 hours. And that would be to an emergency center, to the hospital or your doctor's office or whatever, okay? Maternity benefits are handled the same as any other surgery. They're paid at delivery. They'd be paid 100% as long as it was a reasonable charge. They do not pay each time you go to your doctor for your prenatal care. So, but it is paid at delivery. Prescription drugs are covered under your major medical, so they are subject to your $50 deductible, and they're paid then at 80%, unless they're generic drugs. And if they're generic drug, they're paid at 100%. You will need to have your prescription marked that it's generic. They will not know that unless you tell them. There's a lot of information in this booklet that I want you to read, okay, and then we will discuss it if you have some questions. There are a few exclusions that would not be covered, and they're on page 13. Those are not things that normally you would be having anyway, but I would like you to know there are a few exclusions there. Any questions so far on medical, Sherry?
No.
Okay. Part 2 of this plan is dental. Under the dental, there are 4 classes of services. Class 1 is a preventive or diagnostic service. That would be things like your cleaning, x-ray, checkup, fluoride. You can go twice a year to any dentist, and they'll pay 100% of the charge as long as it's a reasonable charge. They do only pay for the fluoride treatment once a year. There is no deductible on Class 1 or preventive services. You do have a $25 deductible per person, or $75 for the whole family. For other services, Class 2 are restorative services. It would be things like an extraction, a filling, a root canal, that sort of thing. You would pay the first $25, and then they would pay 80%. Under Class 3 services are prosthodontics. That would be things like caps and crowns, bridge work and dentures. Those things are paid at 60%. You do have a $1,000 a year maximum under dental. Class 4 services or orthodontic services, braces are covered at 60%, and they pay no more than $1,200 once in a lifetime. And that also is subject to the deductible. Of course, you pay the deductible one time per year. If you pay it in a Class 2 service, you wouldn't pay it again the rest of the year, no matter what. The other part of our insurance coverage then is vision. Vision is a part of your health insurance, actually, and if you have single health insurance, then you would have single vision coverage, but if you have family health insurance, then your whole family would be covered for the vision plan. Under the vision, you can go once a year, anywhere you want to go, to have your eyes examined, and they'll pay $30 for the cost of the exam. They would pay then $25 for your frames if you're wearing glasses, $25 once a year for the frame, and $25 for your lenses if you wear single vision lenses. If you wear bifocals, they'll pay $50, or trifocals, they'll pay $70. Or if you would prefer to have contacts, you could have either contacts or glasses, but not both in the same year, and they would pay $50 for the contact lenses. So if you went for a routine exam, you might expect that they'd pay $30 for the exam and say $25 on your lenses and $25 on your frames. And there's no deductible on vision. I run through that rather quickly, and there's a lot of information there you'll want to review, and then we'll have a time later that we can discuss any questions that you might have. Do you have any questions right now?
When is the effective date of this insurance?
The effective date would be the date that you sign your paperwork and turn it in to personnel. If you're signing that today and turning it in, then we'll make your coverage effective today. There's no pre-existing condition clause, so any condition that you might have prior to this time would not be excluded. Okay? The next thing we'd like to talk about then is life insurance. The life insurance is written for civilian employees by American United Life. American United Life writes this policy for all employees of the state of Indiana that are not law enforcement officers. There is a chart on page 4. It is a schedule of benefits. What is your starting salary?
$500 biweekly.
$500 biweekly. You can see on the chart that the salary range between $500 and $538 would give you a basic benefit of $21,000, and it would cost you 98 cents out of each paycheck. Now, as your salary increases, your life insurance would also increase, and you could tell by looking at the chart here, once your salary increases to, in your situation here, $538.47, you would automatically go to the next level of insurance, and your premium would only go up 7 cents. Now, if you sign for this life insurance within the first 30 days of your employment, you do not have to furnish a statement of health. You will need to complete this form, printed in black, for the life insurance. However, if you feel that $21,000 is not enough life insurance for you, we can add a supplement to that, which would be an additional amount of life insurance. This form's printed in blue. And you could choose at your salary $10,000, $20,000, or $30,000 in additional coverage. At your age, I can see from your application, from your age it'd be 3 cents a thousand. So if you chose another $10,000 worth of life insurance, it would only cost you 30 cents more bi-weekly. If you have the life insurance, the basic plan, and the supplement, you could also write dependent coverage, is printed in brown, that form. The dependent coverage would be $5,000 on your spouse and $2,000 on each of your children. The premium for that dependent coverage is 50 cents, is just a flat 50 cents. It's not per person, just 50 cents per payday.
And what happens if you're not married at present time and get married at a later date? Would that still be effective?
We could do that as long as we do it within 30 days of the time that you're married. We would have to furnish them with evidence of insurability, but it's a simple form to complete. We just can't make it effective until they give us the approval from American United Life. And you can let me know how many of those you want to complete. The next thing that we have then is Public Employees Retirement Fund, and the acronym for them is PERF. You'll hear people talk about PERF, is Public Employee Retirement Fund. This is a retirement fund that you do not contribute any money to. The state of Indiana, on page 6 here, it tells you 3% of your gross salary will be put aside for you for retirement. So nothing comes out of your paycheck. In order to be eligible for a normal retirement, you would need to be 65 years old and have 10 or more years of creditable service with PERF. Between the ages of 50 and 65, if you had 15 or more years creditable years of service, you would be eligible for an early retirement with a reduced monthly benefit. If you should leave us before you are eligible for either of those retirement plans, you could ask to have the money returned to you in a lump sum. We could do that. The PERF fund is the only thing that is not optional. The insurance plans are optional, and they're there if you would like to enroll in them, but the PERF is mandatory. There are 2 forms, should say, the membership form I need 2 copies of, but if you would complete one of them, that would be all 4 pages of the PERF form, and then just sign the other copy. We'll be glad to type the other one up. You won't have to write that up twice. Any questions about the PERF?
No.
Thank you. The other thing that we have then is a universal payroll deduction form. This is, we call our AS-47. This is a form that we must supply to our fiscal department in order to take your deductions out of your paycheck. And on that form, I need you to complete your name, your address, your social security number, your signature, and today's date. And then we'll be glad to make all of the other necessary coding on there for the fiscal department. Okay, so we've discussed the health, vision, dental, and the other insurance plans. If you're interested in enrolling in the health insurance, I need you to complete this form. You're going to need to make sure that you insert on this form your PE number. Your PE number is a 4-digit number that personnel gave you, and it means you are a permanent employee. And that is the number that Blue Cross Blue Shield will know you by. They're never going to know your social security number. So make sure that you have your PE number here. That is something you'll want to memorize and have available for you. You'll need to list information about you, check if you want health, vision, and dental, or if you want dental only, and you can do that. If you want a family coverage, you'll need to make sure that you include information here about your family, including their dates of birth. If there's any other coverage that you are covered under, like your spouse has other insurance, you'll need to include that information also. Then I need your signature and the date, and we will make this coverage effective today.
Okay.
If you're not interested in the Indiana State Police health insurance that I've just told you about, we do have a health maintenance organization plan, MaxiCare, that is available to people in some areas of the state, and if you're interested in that, I'd be happy to discuss that with you.
Okay.
If you have any other questions, I'd like for you to take time to review the printed information that we've given you, and then we'll sit down and discuss this, and I'll be glad to answer any questions you might have at that time.
Okay.
Okay? Thank you, Sheriff.